never be ready
For a quick minute. Again, my name is Linda McQuarrie, and I'm the manager of forensic operations here at the center, and would like to thank all of you for being here this afternoon. It's definitely our pleasure to honor Representative Storch, who has been such an asset to us in the past and has been so gracious to us when my director and I have gone down to Jefferson City. Thank you very much. I'm going to turn it over now to Mr.
Well, thank you.
You're welcome.
And thanks everybody for coming today. I'm Jay Wood. I'm Executive Director of Missouri KidFirst in Jefferson City. And we work with all the child advocacy centers in the state. And Missouri is very fortunate, in part because of legislative leadership we've had in Missouri, to have a statewide network of child advocacy centers. The child advocacy center movement in the country is fairly new. It's really probably been going strong about 10 years, but maybe for about 15 years that we've really had a discussion about a different way to work with children who have been abused or are thought to have been abused. And the whole child advocacy model is kind of a whole new framework for how communities can come together in a really a private public partnership of people who care about children in a community, and they all grow out of the community, which is a really neat thing. It's not a state agency or a department coming in saying we need this service. The community decides that it's valuable and it's important and they want to do something better and different for their kids. And then this center, advocacy center, grows out of that. Because of some of the leadership we've had in Missouri, Missouri has really one of the first and only statewide networks of advocacy centers in the entire country. And it's nice for me to be able to go to a national meeting, and Missouri is looked up to because we've been able to figure out a way to provide these services to all the counties in the state, and that's something that we're proud of. But it's also something that the Missourians can be proud of because we're giving equal access to both rural and urban children who really need this service. And it's a service that's kind of a long time coming, a different way to wrap services around a child and family who have been victimized or have been suspected of that. And it's really kind of changed the culture around the way we deal with kids who kind of fall into that world. So we're very proud of the center in St. Louis and the services they provide. At the UMSL Center, they have some of the state-of-the-art, some of the best therapeutic response approaches for children and family in the country, and they have some of the leaders there that are working with national groups that do that kind of work. So we're fortunate to have those kinds of resources in the state. We're fortunate, and the reason we wanted to invite Rachel here today is we wanted to announce the very first inaugural recipient of the Missouri KidFirst Child Advocate of the Year Award. And it's really been because of her leadership and her support in Jefferson City and also in the St. Louis area that we were so honored really to even be able to think about presenting this to Rachel in her very first year. It's been tough legislatively, politically on children's issues for some time in Missouri. But because of Rachel's support and really her guidance, and I really can't emphasize that enough, we go to her as much for guidance about how to work things at the Capitol and also politically statewide. And we've really been able to do some proactive stuff. Last year, or the year before last, we were able to get some funding on a very big issue, very important issue to us that supports safe care physicians in the state. Missouri has a network of safe care providers who are specifically trained medical practitioners and nurse practitioners that focus at least a part of their practice on serving children. And unfortunately, a lot of children they serve are sexually abused children. And it takes a high level of expertise and background and also commitment to do that. The Safe Care Network tries to support those physicians, and it's been a real struggle for us in advocacy centers to maintain physicians because we didn't really have a strong network of leadership to do that. And because of Rachel's support, we were able to develop a brand new funding mechanism specifically designed to support safe care physicians in the state through mentoring, training, and information sharing so that we can really build that system up. And we think it's going to have long-term impact on integrating the medical community in the state into the whole child abuse area. So we see great potential in that. And they're talking about wonderful things like training emergency room physicians and primary care physicians on ways that they can be more helpful to children who may have suffered abuse. So we're excited about that. And Rachel was instrumental in that. But we didn't let her get away with just that. This year we put her to work too, and she gladly helped us. One of the issues that advocacy centers have been facing in Missouri because of their growth is we've gone from when the system was kind of first forming as a network in the state of Missouri, working with about 2,400 kids a year, and this year we'll pass well over 6,000 kids, and that's like 120% increase. Each one of those kids takes a lot of effort and a lot of commitment on the part of the community, and we've been searching for years for a little bit of support from the state, because a lot of our centers, their waiting lists were getting so long. And if you can imagine a child who's potentially been sexually abused, and if they're having to wait to get in to talk to a professional and get their medical examination, well, that's just kind of a tragic scenario. Because of Rachel's work, we were able to get some additional funding this year that will allow advocacy centers to bring on more child advocates and forensic interviewers across the state to try to help meet that demand. It's not all the way there yet, but it was a good first step for us to be able to serve more and more kids, and hopefully in more and more areas around the state. So really, I'm just so honored to be able to say that our top child advocate in the state, without a doubt, and working with us and helping us, has been Rachel Storch. And so really today we're here just to announce the award, and I'd like to present to Rachel really an announcement. In March of this year, at our statewide conference that we do in partnership with the Children's Trust Fund, which is a statewide conference where we bring in professionals that are concerned and work with child abuse issues statewide. We'll bring them together into Jeff City, and there'll be a formal awards ceremony for this, but we wanted to recognize Rachel today as the first recipient. So, Rachel, if you'd step forward.
It's been an incredible privilege to work with Jay and Rebecca on behalf of the Children's Advocacy Organization and the Safe Care Network. The Safe Care Network was not something I was particularly aware of until their advocacy brought it to my attention, and then we chased down some funding. And this work is always a little bit bittersweet, because of course the reason we're doing it is because thousands and thousands of Missouri children are being abused. And the year we got the Safe Care funding was of course the year that Sean Hornbeck and Ben Owensby had been abducted, and there was much more public awareness of those kidnappings and the abuse, and I think it created fertile ground for us to get that funding. But it certainly was a team effort. I did not do this alone, and it could not have been done without their help, so I wanted to acknowledge them also, and all of you for the advocacy, the work that you do. I can also tell you that as the daughter of a pediatric infectious disease specialist who's been at Children's Hospital for the last 30 years, I'm acutely aware that things for children in this state are not what they should be right now. I've been particularly disappointed by the cuts to the Children's Health Insurance Program. More than 77,000 kids have come off of the Children's Health Insurance Program over the last few years, and it's going to be very hard to get those kids back, even when we can put some funding back into place. But I think we need to do even more than that. I'm waiting for leadership that gives us a comprehensive vision of where we should be going for children in this state, and some plans to deal with their health and their education and their housing. There are solutions for these problems that are not out of our grasp. They just need better leadership from the top down. And I am eager to go back to Jefferson City and continue that work, because I do think that there are solutions we can find that are within our grasp. And of course, the advocacy work that all of you do is so critical to that answer. It's really the voice for those kids. So it's a privilege to do it. I started with a little anecdote, and I'll end with one, because I think it's so easy to get discouraged in Jefferson City, but I always try and think of this anecdote because I find it very compelling, which is about a little boy who was playing with some kids who were trying to climb a ladder. And all of the children except this little boy were afraid to climb. And later his grandfather said to him, "Why were you not afraid to climb when everyone else was?" And he answered, "All of the other kids, as they climbed, looked down and saw how high they were, and they were scared." He said, "But as I climbed, I looked up and I saw how low I was, and it motivated me to go higher." And I think that's where we need to be. We need to see what we should be reaching for and aspiring to. It's there we can find solutions to these problems with our joint efforts, and it's an incredible honor to receive this award, and I'm just looking forward to the work I know we'll continue to do together. So thank you very much.
Thank you so much.